Move on to Ms. Theroux, Senior Vice President, the Independent Institute.
Thank you for having me today. In addition to working in public policy on an academic level, for 20 years I've been a volunteer with the Salvation Army, and so I am very much concerned with helping individuals as well as dealing with this on a theoretical, academic way. I have brought some studies to share with you. I won't go into them in detail in my comments, but I invite you to look at them at your convenience and your staff's. I think we can all agree that our purpose here today is to discover ways of decreasing the numbers of children in poverty. And as we hear, the causes of children in poverty are many and varied. I'm going to focus primarily on the number one correlation for childhood poverty, which is living in a household headed by a single mother, but much of this applies across the board. The maximum family grant rule is way too late in the cycle of poverty to have a lasting impact on the problem. And in order to have a meaningful impact, we really need to ask some creative questions. Policies such as the one under discussion came out of thinking of the problem as one of people are poor because they have children they can't afford. Surely if the poor understood that having children they couldn't afford made them worse off, they wouldn't have those children. Well, obviously that's simplistic thinking, and this rule hasn't helped. Nor have things like the extension of contraceptive services or the availability of abortion on demand decrease the number of children in poverty. The rate of children born into poverty has continued to rise, even in the face of maximum family grant, universal sex education, and abortion rates that some have termed genocidal. Loretta Ross, who's co-founder of Sister Song Women of Color Reproductive Justice Collective, has observed, if people are not convinced that they have realistic economic and educational opportunities, you could put a clinic in a girl's bedroom and she would still think early motherhood is a better choice. So this flips the question on the head. Is it a matter not that people are poor because they choose to have children they can't afford, or are they choosing to have children they can't afford because they're poor? Increasingly, this conclusion is being drawn by studies. A current Brookings Institution report shows that single women of childbearing age who live below the poverty level are almost 5 times more likely to have a child than affluent single women, and it concludes, women with higher incomes are much more successful at ensuring that sex does not lead to an accidental baby. This almost certainly reflects their brighter economic and labor market prospects. Simply put, they have more to lose from an unintended birth. Therefore, improving the economic and educational prospects of poor women is therefore an important part of any strategy to reduce unintended birth rates. A 2011 National Bureau of Economic Research working paper similarly concludes, our reading of these seminal and influential works is that they find common ground in the notion that growing up in an environment where there is little chance of social and economic advancement leads young women to bear children outside of marriage. These women perceive that they have so little chance for success in life that they see no reason to postpone having a child and may even benefit from having one regardless of marital status. Today, it's far harder for a poor young woman to have access to a quality education, a good entry-level job, or to be able to start her own enterprise than to set up a new household and welfare. California requires licenses for 62 low and moderate income occupations, such as florist, makeup artist, massage therapist, preschool teacher, shampooer, charging an average license of $300 and imposing an average education and experience requirement of 549 days. This is the 3rd highest in the United States, and to a poorer or less educated person are insurmountable roadblocks. Further, California is categorized in the least free category in a ranking of economic freedom among the 50 states. Globally, we've seen poverty rates plummeting dramatically in nations across every region that have liberalized their economic freedoms, with inequality declining in sync with the decline in poverty. Meanwhile, decades after a nation at rich identified our failed public education system as a primary driver of the cycle of poverty, and countless follow-on studies, documentaries, education reform initiatives, poor parents are still offered little to no say in where their children are enrolled, regardless of outcomes. Increases in public school spending go primarily to increased administrative costs and correlate oddly with declining educational outcomes. A higher percentage of students test proficient in reading and math in states that spend the least per pupil in instruction, Arizona and Oklahoma, scholarship programs. For 16 years at the Independent Institute, we've operated a private voucher program providing economically disadvantaged families in the San Francisco East Bay freedom to choose a private education for their children. This area alone has 300 private schools, and they're providing educational reports for the very demographics that are failing otherwise. Your tax-paying constituents will not thank you for expanding welfare benefits. It's not that they want to see children in poverty. It's the single dollar bills put into kettles that fund a lot of the Salvation Army programs that are so effective in helping families up and out of poverty. Your tax-paying constituents don't think it's fair that they work hard and make hard choices. That's the point. The pattern of poverty used to be primarily a one-generation phenomenon. Talk to any social worker today, and they will say now it's odd and they're puzzling over why. You used to help one generation, and they would get, like you, up and out, and their children would do better. Today we see a pattern of multi-generational poverty, where the children of parents who were helped 20 years ago coming in today in as great or even greater need, and that's what we need to figure out, what is broken. So we're puzzled over people in poverty having children they can't afford, which is the driver for this policy. But we need to understand that people are making choices based on the options that they see. So if they're not seeing any educational or economic opportunities, having a baby can indeed look like the best option available. They think, if I don't have a baby, what else am I going to do? So this policy hasn't produced the expected result. If you're already in poverty and receiving welfare, not receiving additional welfare isn't enough of an incentive to stop having another baby. You're already poor. What's a little more or less poor? The former national commander of the Salvation Army used to rally me and other of his followers with the cry, "We're not here to make poverty comfortable." This is not a life we would choose for ourselves. So why do we think it's okay that the best option available to people is establishing a household and welfare? This is tragic. It's locking entire families into poverty without hope. We all want to see policies that help the poor get out of poverty. We all want to help with a hand up. And that's the stated mission, for example, of Mr. Mecca's agency, to promote a human services system that encourages self-sufficiency of families and communities. And I think that's all of our dream. So I believe that if you really want to help see fewer children in poverty, the policy implications are clear, allowing true school choice, including providing parents and teachers the option of establishing or taking over and running their own schools, and eliminating the economic barriers, including burdensome regulations, taxation, licensing, and zoning restrictions that protect established economic interests at the expense of the poor, are anti-job and anti-small enterprise. Thank you.
Thank you very much for your testimony. I'm sorry Senator Stone, who invited you to be here today, wasn't able to be here to witness it. Just a quick question, just because I've known Loretta Ross for 25, 30 years. Could you give me the source of the quote?
It was from a story in Time magazine. I'd be happy to send it to you.
Okay, I'll call her myself and get the full thing. Thank you.